Vitamin D is commonly known as the sunshine vitamin, and it's essential for growing strong bone, having a good healthy immune system, and looking after your mood. Hello, I'm Dr. Anne, and I'm going to run through everything you need to know about this powerful vitamin. What is vitamin D? Well, vitamin D belongs to a family of compounds, usually D1, D2, and D3. It is a fat-soluble vitamin, and it's more versatile than lots of people think. It not only maintains bone health, but it helps regulate minerals like calcium and phosphorus in your body. What's more is it looks after your immune system, so it makes sure you stay healthy. While being exposed to sunlight also helps produce vitamin D, vitamin D is also found in foods, and supplements are a powerful way of getting vitamin D. So what's the difference between D2 and D3? D2 is also known as colecalciferol. This is usually a plant-based source, so found in foods like yeast or fungi. Vitamin D3 is also called colecalciferol. This is usually found in animal-based sources such as fish, but it's also the kind that your body makes after being exposed to sunlight. When the sunlight hits your skin, it changes a chemical called, which is usually found in your skin, into a pre-vitamin D3, which is then quickly converted to D3. D3 is usually considered a more potent form of vitamin D than D2, so when you have D3 in your diet or in supplements, it's generally converted faster and more efficiently into active forms. So this means that vitamin D3 is usually better at raising your vitamin D levels. Which vitamin do I use? I generally use D3 supplements, and I also try to make sure I get enough vitamin D in my diet. But the bottom line is, both forms of vitamin D are useful ways of getting vitamin D. I also like to get natural vitamin D from the sun, so often I will go into the sun. Generally that's around 30 minutes of midday sun, but it will depend on what the climate is, what the temperature is, so you need to decide what's best for you. Some benefits of vitamin D include mood regulation. Research has shown vitamin D can be an important tool in helping regulate your mood. In fact, if you have a low vitamin D level, it is linked to anxiety and depression. Number 2, losing weight. If you have excess weight, this means you're more likely to have lower levels of vitamin D. Number 3, vitamin D is important for bone health. Vitamin D also helps calcium regulation, which is important for bone health, to help your overall health and prevent you getting severe illnesses. Simply put, vitamin D is an important powerhouse and your immune system's best friend. What are the symptoms of vitamin D deficiency? You might notice you have symptoms like fatigue, body aches, mood swings, and weak bones. When the body doesn't have enough vitamin D, it's very difficult for it to absorb as much calcium as needed. This can lead to a variety of problems such as rickets, which more commonly occurs in children. It could also cause osteomalacia and osteoporosis. This is usually in adults when bone health is impaired, leading to weak bones. These can predispose you to having fractures. That's why it's important to regulate your vitamin D levels for bone health. Given how tricky it is to find out if you have vitamin D symptoms, because they can be quite vague in some people, who's most at risk of getting vitamin D deficiency? For example, if you have a vegetarian diet, you might not have enough vitamin D3, which is usually found in animal protein. If you have a darker skin tone, like myself, you might be more at risk of vitamin D deficiency, as you have a harder time absorbing as much vitamin D from the sun due to the melanin in your skin. If you spend a lot of time indoors, you also might be at higher risk of not having enough vitamin D. Age can also play a factor. As you get older, you have a harder time producing vitamin D. How do we diagnose vitamin D deficiency? Vitamin D testing is becoming more and more routine. You might be able to get a blood test from your doctor. Your doctor will usually decide whether or not you need blood tests based on your symptoms or if you have any other health conditions. In some cases, you might also need X-rays or further investigations. This will again depend on risk factors or your symptoms. Can you have too much vitamin D? Firstly, vitamin D is essential and it's very, very difficult to have an overdose of vitamin D. But if you take excess amounts of vitamin D over a prolonged period of time, it could lead to too much vitamin D. If it starts to disrupt your calcium levels and your calcium regulation, it could lead to further health problems. Hypercalcemia is when you have too much calcium, and that can impact lots of important body functions like in your heart or your kidneys. If you're getting the majority of vitamin D from sunlight, in those situations it's much rarer to develop complications and too much vitamin D building up. Food and vitamin D. Can you guess which ingredients make the top list of getting vitamin D in your diet? Our diets offer a variety of ways of getting enough vitamin D, and often foods are fortified. That means there's extra vitamin D added in. You might want to consider fish like salmon, sardines, tuna, shrimp. Eggs are also worth considering, and that's because egg yolks also have a significant amount of vitamin D inside. You also can get fortified foods like I mentioned earlier, so milk, cereals, yogurt, even orange juice. My personal favourites is to include eggs and fish into my regular diet. While sunlight and diet are important factors, a lot of people will need to take vitamin D tablets, and that's because they might live in places of the world where they have less sunlight, or they might just not be able to get enough on their diet. So how do you know which one to take and what the dose should be? Well, I'm going to go through some essentials now. Your ideal dose will depend on age, lifestyle, health conditions, where you live. Another way is to decide which method is best for you. Some people prefer drops, other people prefer tablets or gummies. Keep an eye on price. Vitamin D is often needed for a long-term use, so you need to decide which one has a price bracket you can afford to keep taking. Ingredients vitamin D is often combined with is calcium, which is great for bone health, K2, which is good for cardiac and bone health, and magnesium, which can be good for overall well-being. What dose of vitamin D should I take? At the moment, the guidelines suggest around 10 micrograms of vitamin D a day. This includes for a child over 1, if you're pregnant, if you're breastfeeding, or at risk of vitamin D deficiency. 10 micrograms might also be expressed as international units, which would be around 400 IU. So the summary is, vitamin D is important as part of your overall health. You can get it from sunlight, diet, supplements. Decide the dose which is right for your age, your health, and your overall needs. And if you have symptoms or you're concerned, it's best to speak to a doctor. Thank you for watching, and write any questions down below. The Travelling Duck.